Hi guys. Our topic is angry and overcontrolling men. How would we define this order? So first are characteristics and control. So characteristics of an angry and overcontrolling man is 1, obviously that he is controlling. 2, he feels entitled. 3, he twists things into their opposites, which means that he'll make something that he does badly, like if he punched his partner, he would make it sort of seem like it was her fault. So he kind of flips that. The next one is he disrespects his partner and considers himself superior to her. He confuses love and abuse, and this kind of goes along with the saying, you hurt the ones you love the most. So he kind of blames his abuse on his love for her. The next one is he's manipulative. He strives to have a good public image. He feels justified, and this kind of means they sort of believe that their partners make them act in abusive ways. So if he's angry, he'll be oh, she makes me act like this. I wouldn't act like this if it wasn't for her. And the last 2 are that they deny and minimize their abuse, and that they are possessive. And sort of a really big idea of angry and over-controlling men is control. Coercive control is defined as a strategic course of oppressive behavior designed to secure and expand gender-based privilege by depriving women of their rights and liberties and establishing a regime of domination in personal life. This reminds us that women are often targets of violence. And this book by Lundy Bancroft called Why Does He Do That? Inside the Mind of Angry and Over-Controlling Men gives us sort of 3 different spheres of control that these men kind of display in general. And the first one is they control arguments and decision making. So basically, it's just impossible to be right with them. They always have to be right, and they're so set on that you can't even argue with them because it's just impossible. The second control is personal freedom. So this is kind of when he has to control every single thing his partner does, what she wears, where she goes out, who she is friends with, if she can see her family, when she can see her family, and so on. But then their personal freedom isn't affected at all. They're allowed to do whatever they want with no consequences. And their third sphere of control is parenting. And this is if they have children together, he sees himself as the authority figure. He controls the children, even if he doesn't spend time with them. He's not really the one mainly in charge of them, spending his days with them, but he's still that figure no matter what, even if the partner does way more with the children. The second bullet point is different moods and types of men. So usually these men have different moods, meaning they're a different person day to day or hour to hour. At times he can be super aggressive and intimidating. And when he's in that mode, nothing that someone says to them can change them, and it just makes them angrier. But at other times, he can be in a mood that's sort of described as wounded and lost and searching for love, and he wants someone to take care of him, and he appears open and ready to heal, and he seems to let his guard down, and maybe it seems as if he's changing, and so it's just hard because the partner sees them in both sides of this. and like she sees that he's super angry and can't get out of that, but then she also sees that like how can like this troubled sort of like helpless person, he's like, oh, this, he could never like go back to his ways, but it just like changes all the time. And the different types, so the same book by Lundy Bancroft gives a bunch of different types of like subtypes of the disorder, angry and over-controlling men, and I'll kind of try to list them off fast. But the first one is called the demand man, and he is highly entitled and expects his partner's life to revolve around his needs, and he's angry if he doesn't get his way. The second one is Mr. Right, and Mr. Right considers himself the ultimate authority on every person. Like, basically, if you're talking to him, he just brushes your opinions aside, like they don't even matter, because he's the only person who could be right. The water torture is kind of like a quieter abuser, and he kind of like assaults his partner psychologically. Like, he won't raise his voice, he'll be calm in arguments, but like he often has a superior grin on his face. He's kind of smug and self-assured, and he like uses aggression through like sarcasm and like conversational tactics, like laughing at her, mimicking her, or like making cruel remarks. The fourth one is the drill sergeant, which is taking controlling behaviors to the extreme. He runs his partner's life in every way he can, criticizes her clothing, tells her when she can and can't go out, and yada, yada, yada. Just kind of ruins everything for her in her life. Like, she can't have anything for herself. The Mr. Sensitive is one who kind of wraps himself to be like a cover man. Like, he kind of persuades his way, and like if you start feeling mistreated by him, it's you that is like, so that has something wrong with you. And like if you tell somebody else that he's mistreating you, they're gonna think that you're the one who's like spoiled. They're like, you're not in your right mind because he's super persuasive. The next one is the player, and that's just sort of like he's flirting and like doing all these things with his other women, and you never really know if he's cheating on you or not, and he kind of like uses those mind games with other women to like abuse you. The next one is Rambo, and this person is aggressive with everyone, not just his partner. He gets a thrill out of the sensation of intimidating people and strives to handle life situations by creating fear. He like has a stereotypical view of what a man's supposed to be like, and sees woman as delicate and inferior, and like needs a man. The next one is the victim, which is kind of self-explanatory. He kind of acts as if he's the one getting abused and it's all his partner's fault, and it's not. Like, he has nothing to do with it. And the last one that they explain is the terrorist, and this is a person who tends to be both highly controlling and demanding, and he basically frequently reminds his partner that he could rip her to pieces or even kill her. They terrorize their partners with threats and just like terrible behaviors, and just use those threats as their abuse. And then one thing I just wanted to mention along with this is that it's super easy to get caught up in these relationships for these women because of this thing called the Garden of Eden stage. And this is the first few months of the relationship with the man is like heaven and perfect, and the man shows no signs of these, and it seems to be super healthy and just like going so strong and wonderful. And then all of a sudden, like, it just flips, and like, but the woman wants to hold on to it because she thinks that, oh, if he was good before, he can be such a good person. Like, I'm gonna fight for him because of how good he is. And like, she kind of just gets her head wrapped up in like what it was and thinks it can go back to that. So yeah.
We're going to be moving into types of abusive disorders. And my name is Brenna Stratton. And the four abusive disorders that can be classified under angry and controlling men are borderline personality disorder, antisocial personality disorder, narcissistic personality disorder, and intermediate explosive disorder. And there's plenty of other disorders that can cause men to act angry or over controlling, but here there's just four that we're going to touch on today. And also, these disorders are not gender specific, so even though we're talking about men, like women can be diagnosed with these disorders as well. So the first one, borderline personality disorder, is defined by the DSM-5 as a pervasive pattern of instability of interpersonal relationships, self-image, and affect and marked impulsivity beginning by early adulthood. Some symptoms include out-of-control emotions, unstable interpersonal relationships, concerned about abandonment, self-damaging behavior, impulsivity, is frequently accompanied by depression, anxiety, or anger. And actually, this disorder is mostly diagnosed in women, but it can be found again in men. And so, how this would look like if a man is angry or over controlling is the man is probably over concerned about abandonment, so that can cause them to be over controlling to those that they're close to. And then also, this person can harm themselves as a result of doubting that people in general love them or simply to gain attention from them. They also will go back and forth between spouts of anger, anxiety, and depression. And then a case study by Jefferson Journal of Psychiatry shows that a patient who was a 23-year-old Caucasian male had symptoms that first started as insomnia, and he said it was due to feelings of guilt and anxiety. Then after going to therapy for the first time to fix this, he developed symptoms of severe depression, suicidal thoughts, and cutting himself with a razor. The symptoms got more intense, enough that he would imagine knocking random women he came in contact with unconscious just to mutilate their sexual organs with a razor. He never succeeded in doing this, but was distraught that he actually attempted this. And so this can show how borderline personality disorder can be evident in some abusive relationships between a man and a wife, and how a man can become angry all of a sudden and want to and be over controlling in so much that they could harm a woman by doing like sexual abuse or physical abuse. And then the next one, antisocial personality disorder, is a disorder that tends to gratify one's own desires with no remorse to harming oneself or others. This is defined by the DSM-5 as a pervasive pattern for and violation of the rights of others occurring since age 15 with at least 3 of the following symptoms: failure to conform to social norms with respect to lawful behaviors, deceitfulness, impulsivity or failure to plan ahead, irritability and aggressiveness, reckless disregard for safety of self or others, consistent irresponsibility, lack of remorse, and then the person must be at least 18. This can occur in angry and over-controlling men because they have no control over their id or own desires. This means they'll do whatever it takes to satisfy this desire, even if it means harming another person or controlling them through manipulation or aggression. And the next disorder is the narcissist personality disorder, and this is defined in the Abnormal Psychology book by Susan Nolan Koksma as a disorder where the person acts in a dramatic manner and seeks admiration from others, but are shallow in their emotional expressions in relationships with others. They tend to rely on their own inflated self-evaluations and see dependency on others as being weak. And this can occur in angry and over-controlling men because narcissists tend to only care about their own personal success and will compromise personal relationships to achieve this goal. And then the last disorder we're going to talk about is the intermediate explosive disorder, and defined by the Mayo Clinic, it is repeated sudden episodes of impulsive, aggressive, violent behavior or angry verbal outbursts in which you react grossly out of proportion to the situation. And so what's unique about this disorder is that it can also be seen in children as young as age 6. And then these outbursts must be overly out of proportion and seems like the anger is out of control. And then this can be seen in angry and over-controlling men because they could overreact to a simple thing that their wife or child does. And then an example of this could be a child who might leave a remote on the couch, and instead of like putting it away, so the father would throw the remote at the child's head out of his anger. So that would be something that is out of proportion and definitely would be abnormal to the situation.
Okay, so today we're going to explore the causes of angry and over-controlling men. We're first going to start with some biological theories. So several genes have been associated with oppositional and defiant symptoms, one of these being monoamine oxidase A, which is a gene that controls serotonin and dopamine and norepinephrine. Serotonin, of course, being the emotional well-being neurotransmitter, plays an important role in violent, angry behavior in men. A study of a large community-based sample found that young men with high blood serotonin levels were more likely to have committed a violent crime than those who had normal serotonin levels. And several studies have found that children who have both an abnormal variant of the monoamine oxidase A gene and a history of childhood maltreatment are especially likely to develop aggressive traits. So obviously, genes play a role in men being more prone to being angry and over controlling. So neuroimaging studies have also shown abnormalities in the functional areas of the prefrontal cortex and anterior cingulate. So these areas of the brain control responses to emotional stimuli, and if a person has issues with these areas of the brain, they cannot process emotional cues the way that healthy children do. This means that an individual could act more angrily than a situation calls for, which could be a possible cause of men being more angry. Maternal exposure to neurotoxins or drugs when pregnant can also cause some neurological deficits. So there was a study of boys whose moms smoked during pregnancy, and the study found that the boys are 2.6 times as likely to demonstrate oppositional behavior in early childhood, and then followed by more aggressive behavior as they grew older. So it looks like prenatal exposure to neurotoxins definitely plays a role in men being more angry. And then we see higher levels of testosterone. So people often associate testosterone and angry, aggressive behavior, but the hormone is not all to blame. It more so depends on the social context of the person. So if a person has high testosterone and the people that that person's around, if they're socially deviant, then the person with high testosterone is more likely to be deviant, but that does not mean that high testosterone means that a person is going to be more aggressive and more angry. Some psychosocial factors are children who are physically abused or severely neglected by their parents are more likely to develop disruptive and delinquent behavior. These parents of these children are also more likely to physically punish boys more severely than girls, which can account at least partially for the higher rate of conduct disturbances in boys over girls. Attachment is dependent on parenting. So if the parent is absent and apathetic and neglectful, children are more likely to develop anxious attachment. As an adult, anxious attachment style can manifest as difficulty trusting others, low self-worth, worries that your partner will abandon you, being really dependent, requiring a lot of reassurance from others, and being very sensitive to your partner's actions and moods. And research shows that men generally score higher in anxious romantic attachment than women, and they also express anxious attachment behaviors more often. So it can be a contributing factor to men being more angry and over-controlling if they're really sensitive to what their partner does and they're very insecure in themselves and they just don't trust others. So it can cause them to be more over-controlling over what the partner does. Research has also found that family background plays a role. Typically, people who are easily angered come from families that are disruptive, chaotic, and not skilled at emotional communication. And we know learning is social and cultural, so if a child observes their parents being violent and more angry and unable to communicate emotionally in a healthy way, then they're going to be bad at communicating emotionally as well when they grow up and get into their relationships. And emotional communication is something that's especially more difficult for men. So it can cause them, if they don't know how to learn that, then they can be more angry and over controlling in relationships in the future. And peer groups, young children who live in neglectful families will turn to peers to receive validation and escape their parents. But if their peer group is full of a bunch of unhealthy, toxic people who encourage delinquent acts, then those people in those groups will become more deviant. And people who become part of a deviant peer group are also more likely to abuse alcohol and drugs, which we know can lead to even more aggressive behavior if an individual is under the influence of alcohol and drugs. Children with conduct disorder symptoms process information about their social interactions in different ways that can also promote aggressive behavior. They assume others will be aggressive towards them and use these assumptions rather than social context to interpret their peers' actions, and as a result, they can act more aggressively towards others. And male adolescents in particularly are especially aggressive, getting into more physical fights than women. A study in 2017 showed that 30% of males got into a physical altercation versus 17% of women. And finally, we have to take culture into account because culture defines what triggers an emotion, rules for the display of emotions, and guides how we value emotions. So the US encourages emotional expression, while in collectivistic cultures, it's better to suppress emotion for group cooperation and harmony. So the US is individualistic, so self expression and self assertion is ideal. And we have some gender based differences. So men see anger as a powerful emotion, and therefore, it's more tolerated, and it's even important if it's clarifying a situation. While in collectivistic cultures, they value groups over individuals and promote harmony within the group rather than individual assertion. Emotions are seen as more like an interactive experience and reflect the social context rather than the inner self. So collectivistic cultures emphasize the maintenance of cohesion within the group, and therefore the control of emotion has a high priority, while in the US, we value the individual, and so individual expression is ideal. And in Western cultures, we encourage women and men to engage in different paths of emotional expression, and because anger is a more powerful emotion, men like to elicit that more rather than vulnerable emotions such as fear and any kind of weakness. And because it's more socially acceptable for men to express anger, they're just more likely to express it. So those are some of the possible causes of men being over controlling and angry.
Hi guys, I'm Gabby, and I will be discussing some of the forms of treatment used for angry and over-controlling men. There are a lot of different reasons and disorders associated with this, so I'm going to focus on the four that Brenna spoke about earlier, while also giving a brief overview of types of therapy and medications used for treatment. All four of these disorders are hard to treat, and therapists will mostly utilize medications and cognitive behavioral therapy in order to help treat them. Some key things therapists will focus on for cognitive behavioral therapy will include getting rid of cursing and negative language and instead using rational thoughts, avoiding using never and always, and instead using logic to appeal to the individual, teaching them that instead of getting upset that they can't solve a problem, that they can learn how to handle and face a problem, because not every problem will have a solution. Using humor as it diffuses anger by not taking everything so seriously and getting the individual a more balanced perspective. And one article that I read that looked at how to treat men with anger problems that used cognitive behavioral therapy stated that key treatment issues included establishing a therapeutic relationship, facilitating and understanding the cognitive basis of anger, and addressing male role socialization messages and male identity schema that contributed to the experience and expression of anger in these men. So medication will work on some disorders better than others. Common medications that are used would be mood stabilizers such as lithium, serotonin, and norepinephrine, which are reuptake inhibitors. Now I'm going to move on to just these four personality disorders, which Brenna spoke about and gave detail about, and speak about the treatments for each one. For narcissistic personality disorder, a therapist will use cognitive techniques in order to help the patient create more realistic expectations of themselves and others. The textbook states that there have been no studies regarding psychotherapy or medication to treat narcissistic personality disorder, so cognitive behavioral therapy is greatly utilized. Borderline personality disorder is one that can be difficult to treat, as many individuals can have other underlying disorders, such as depression, PTSD, and generalized anxiety disorder. One form of treatment that can help a patient with borderline personality disorder is dialectal behavior therapy, which is aimed to help patients have a more positive sense of self, find skills to help with regulating emotions, and to teach patients how to improve their relationships by expressing their feelings. Support from loved ones and a therapist, plus medication, is beneficial in helping decrease an individual's impulsivity and thoughts. Treatment for antisocial personality disorder can be difficult as most individuals will deny their need for treatment. Instead of trying to aid in the patient's understandings and feelings, therapists will try to help the patient get a hold of their anger or impulsive behaviors by finding their triggers. Medications that can help treat this disorder include lithium and atypical antipsychotics. Patients with intermittent personality disorder will often go through cognitive behavioral therapy in order to help them identify and avoid triggers that can lead to explosive episodes. So for all of these disorders and just in anger in general, cognitive behavioral therapy, it can be very helpful in terms of kind of understanding where this anger may be coming from and helping them find skills that can help them control their anger while also finding things that may contribute to their episodes and trying to put a stop to them. It also helps with them acknowledging their anger and the effect it is having on the people around them.
Hi, my name is Madison, and I'm doing the application of the virtue part. So we chose to do self-discipline because we felt like it had the most influence through their interactions with angry and over-controlling men. So self-discipline is defined as orderly or prescribed conduct or a pattern of behavior, and to train oneself by instruction and exercise of that behavior. And through all the different disorders and symptoms that we mentioned that someone experiences, they kind of have to learn how to control their bodies in the different environments that they put themselves in. So applying that to Christian perspective, a verse that kind of goes along with that is Hebrews 12:11, and it states that for the moment all discipline seems painful rather than pleasant, but later it yields the peaceful fruit of righteousness to those who have been trained by it. And so basically, our actions should reflect God at all times, and when we discipline ourselves, we live in a way that is honoring to Him. And for others, looking on the outside, looking in at the person that's angry and over controlling, we can use self-discipline by not being quick to judge that individual, but discipline our actions and actually help them instead. And then for the angry and over-controlling man himself, just like we mentioned in the treatment part of the slides, they need to establish a good habit in controlling their emotions and be able to react to the triggers that are all around them. And angry and over-controlling men, their main issue is their instability of their personality with a strong desire to harm someone or something in some way. Physical, mental, anything. So by having self-discipline, it goes a long way because especially if they can control their actions towards women in general who are closest to them, because like we said earlier, is 60 to 80% are abused by them. To prevent further destruction, managing through either medications and or cognitive behavioral therapy, it can help the individual in the long term and then live a healthier life. As Christians, we need to love and support them in the best way that we can. It's kind of hard if they're physically abusive, but the power of prayer, encouragement, or just to be an outlet to a resource that they can get help from even helps them. But just like the verse said, it said later, it will lead to a peaceful fruit of righteousness. And through practicing constant exercise of that brain, that he is not entitled, he doesn't need to hurt anyone, or that he can manage his emotions once they're in stimulus. would normally set him off, he demonstrates self-discipline instead, which in the long run is honoring God. So yeah, that's kind of how we took the Christian perspective and self-discipline through Angry and Over-Controlling Men. Thanks.